Okay, so let's resume from the clinical audit cycle. What is the clinical audit cycle? You identify the problem, you establish an international standards, or you will not say you will establish, you take up the international guidelines, you match them, you analyze it, you do some intervention or change, and then you do a re-audit to see whether your change has improved or not anything in the outcome of the patient. So this is how you will go along the way of a clinical audit. There are two types of clinical audits. First one is a standard audit based on established guidelines, like the NICE guidelines or anything else like that. That one I can suggest you is there was a pediatric fever management guideline because hyperthermia can lead to complex problems in the pediatric population. So they have established a proper guidelines for that. And when a baby arrives with hyperthermia, what do you have to do? You have to do sponging of the baby. You have to use paracetamol. You don't have to use Brufen and Calpol and stuff like that. And what else you have to do? You have to report, you have to see for the danger signs and stuff like that. Okay. So those are the standard guidelines, and then you will see are they being followed in your department or not. And what are the peer review audit? Peer review audit is a comparative audit among the peers. Okay, so there's a hospital in US that is a very high standard hospital. What you will see is how they are managing the patients. Whenever a patient with trauma comes to their department, how do they manage it? And what guidelines have they established? So you will take those guidelines and you will see, is my hospital following those guidelines or not? Okay. So this is known as the peer review audit. There is no international guidelines on it, but you will take up one international hospital or one standard hospital or one you can say a top ranking hospital, and you will see how they are managing it and how your process compares to them. So this is known as a peer review audit. These two are the main types of clinical audit. For example, another example, audit on whether IV fluids are documented properly in the ER logbook. Are they being documented properly? Is it being checked that how many liters of fluid is going to the patient? Is it not that more IV fluids are being given to the patient and stuff like that? Okay, so this is an audit. Instead of you do an audit on managing heart failure in five different hospitals. Managing heart failure in five different hospitals, you cannot do that. Okay, because there is no specific guidelines for managing the heart failure. One professor would say, I manage heart failure in this way. Okay, so there's like a specific way to manage a heart failure. If there is a proper way of managing heart failure, you can do that. But what will happen in this case is heart failure is a very long chronic disease. You have to follow up the patient for a long period of time. So instead of doing that, you can, for a clinical audit, go for a topic that is that you can easily do, like anything that is affecting the system, the process. Okay. I will give you guys one more example that I did an audit on that was on the nurses' cards, the emergency card, okay, that is managed by the nurses. So it was that what medications should be ideally be there in that crash card and what medications are present in our hospital, okay? So that is something that is internationally recognized and you can just follow it. So first thing you have to see is you have to plan and define the scope. Where will you conduct it? Will you conduct in the medicine ward, the surgery ward, ER, OPD, or where will you do that? And the second one is you will find out the international guidelines. These are the things that we will later on see. This is something that you have to be focused about, that your topic should be specific, measurable, attainable, relevant, and time-based. There are different data collection methods that you can do. First thing is the patient questionnaire. You can take the patient questionnaire and ask the patient. As I gave you the example of the fever management, you will go and ask the mother of the baby, was the baby sponged? Was the baby, were the clothing removed? Which kind of medication was given to the baby? And how was, mother, you can ask the mother of the baby, or you can ask any person else if he's presenting with trauma to an ER facility. You can ask him, were you given first aid? Was your wound washed? So this is an example of a patient questionnaire. The second one is medical records review. Medical records review means that you will see his file. Is the patient being managed properly? A patient who has come with asthma, was he given nebulizer? Was he nebulized? Was he given, if a patient has presented with renal failure, has it been that he was given a loop diuretic and stuff like that? Okay. But these are not, I would say, a guideline. This is not an example of an audit. Audit is you have to follow up the guidelines. Okay. You have to check the guidelines. Are the guidelines being followed or not? Then we have the direct observation. If I am doing a clinical audit on passing Foley's catheter or passing the nasogastric tube, instead of just asking the house officer or the junior doctor, did you pass or did you check for the nasal septal deviation or did you wash your hands and stuff like that? It is better for me to directly observe. It is better for me to observe that doctor, is he doing that thing or not? Okay, this is another one example of an audit. Okay, audit data collection method. And then we have the electronic health record. You can just check out the data on the computer. Another one we have is the data and audit of anesthesia guidelines. I just go on the operation date of the any surgical ward, and I see, is the anesthetist following the guidelines? Is he asking the required questions? Is he checking up the patient's heart rate or dextrocardia or the scores that should be checked by an anesthesiologist and all that stuff? And is the surgeon following all the pre-op preparation of the patient or not? Is he scrubbing the patient properly? Is he preparing the patient properly? Was the patient informed? These are all the guidelines are available on internet. Okay. You can all check them all. Okay. So the next step would be after, then we will go for the intervention. So that was one thing. Now I will give you the hands-on. That would be in the second, third part.